Thank you. I will now turn it over to Program Manager Kate Stenyan.
Thank you, Keisha, and hello, everybody. I almost said good morning, but I realized technically it's not morning anymore. So thank you all for taking time out of your super busy schedules to join us today for our second Delta webinar on stabilizing and re-engineering operations to recover and succeed. So the first webinar was held last Friday, and Eric Scorzoni and Alyssa Miller and Bethany Adams went over that economic impact of the healthcare section and the healthcare's role in community development. And as a follow-up from that first webinar, all of you should have received not only a link to the recording of that webinar, but also your economic impact document, which was a one-pager. If you haven't received that information and would like to follow up, please let us know. You can email any of us and we'll make sure that you have that. Today, we are taking the next step to discuss how the DRCHSD program can support you moving forward. So last week, we've discussed that intersection between the community development and the community care coordination piece. And the intersection between the health and wealth is really where your opportunity lies to further connect your hospital and clinic priorities with the priorities of your community through community outreach efforts and community care coordination planning. So we want you to see, and we want to see too, and understand how we can help you expand the way each of your hospital and our clinics are working with your community. So as a reminder, the National Rural Health Resource Center is the technical assistance provider for the Delta Region Community Health Systems Development Grant. And the Delta Grant is funded by the Federal Office of Rural Health Policy in partnership with the Delta Regional Authority. So now I am going to turn it over to the Delta Program Specialist, Shannon Norman, and Shannon is going to walk through the agenda for today's webinar. Shannon?
Thank you, Kate, and good afternoon, everyone. Thanks for being with us on this Monday afternoon. Last week, we focused on why it's important for each of your organizations to plan for stabilizing and re-engineering operations so that you can recover and succeed in the changing healthcare landscape. Today, we're going to focus on the how and what. Over the past few weeks and months, we've had opportunities to talk with many of your teams, including community champions. We've heard some of your needs and some actions that you've taken to impact community health and the local economy. And we hope to continue that conversation by having your peers share some examples today. We'll discuss the goal of the Delta Program Technical Assistance, which is to ultimately strengthen the local healthcare delivery system, and we'll provide holistic examples of how this can be accomplished. Our purpose is to make sure each of your organizations are aware of how the Delta program can support hospital, clinic, and community leaders with technical assistance services, and to help you recover, stabilize, and move forward. We can help you expand the way you're working within your communities and to build off of the work you've already started by connecting community care coordination with hospital, clinic, and community priorities. And with that, I'd like to hand it over to our Chief Operating Officer, Alyssa Miller, to dive into the how and what. Alyssa?
Great, thank you, Shannon. Like Shannon mentioned, today's time will really be spent on providing a specific example or scenario how the Delta Region Community Health System Development Program, or whom you reference, Delta, can help you with your current organization to stabilize, re-engineer operations to recover and succeed in the current economic and healthcare landscape. Our goal today is for each of you to see this program as a resource to you. And when I say a resource, I don't mean that you have access to what's just on our website, but we do have many excellent tools and how-to guides there. But access to nationally recognized industry experts, access to the center's technical assistance and process expertise. And I have to say that if our key Delta program partners don't have the expertise or center doesn't have it, we know who does and we'll connect you. I don't mean this flippantly, it's true. The Federal Office of Rural Health Policy and Delta Regional Authority and the Center wants you to really understand and use the services and monies from this grant in a way that's customized to meet you where your organization and community are at. This slide outlines 6 strategic priority areas of the program. 6 areas that provide a holistic foundation to support a sustainable local system of care. Last Monday, we spent time connecting the importance of community coordination. We all know and understand that it's essential to have a hospital and our clinic to practice the care, but it's also essential to community development, specifically the economic contribution to the community. Today, we'll provide one potential example that will connect how the work each of your organizations is performing across the priorities listed in this slide. They interconnect with each other to support an economically and healthier community. During our discussion last Monday, we heard from many of you the need to get patients back in for services. Your revenue is down. So the focus of the example that we'll walk through on the next 2 slides is to increase patient visits. Again, this is just one example. The sample questions that I'll walk through today are just that, samples. The answers to the questions are just one of many potential answers. We want you to get the juices flowing, ideas generating, and how the Delta program can assist you. We also are aware that many of you have activities with the Delta program happening in a few of these areas already. And as we walk through the questions and answers on this slide and you hear voices from the field, we want you to see opportunities in your work that the grant can help you with. So the questions and answers on this slide are written from the perspective of the hospital and our clinic and answering them. So many of the organizations in this grant received some type of financial assistance. So the hospital and clinic may be asking, did we receive a CMS Accelerated and Advanced Payment Program loan or money through the SBA Paycheck Protection Program or some other type of financial assistance that we need to pay back? Well, yes, we did. We know that we need to file an interim cost report because of that. Also, during our financial operational action planning session, we identified the opportunity to increase our service lines if we expand access through the use of telehealth. Is that feasible option for us? Under the quality area, one of our action plans from our quality improvement assessment is an emergency department redirect program. What processes do we already have in place to redirect non-emergent emergency department patients to our primary care or specialty services? Well, our champion is conducting phone calls, but we don't have an established emergency department redirect program. We also know from looking at our ED admit and diagnosis codes that many of our visits are due to behavioral health reason. Under our workforce, addressing our workforce needs, what do our essential and furloughed employees need to stay or return to work? Well, we need all staff to be at work as scheduled so that all service lines and clinic operations can open. But many of our employees have young families. Schools are closed for the summer. Local daycare is having trouble securing clean supplies and safety equipment to provide safe environments to work and take care of the children. So there's struggle opening right now. How can telehealth support reopening and/or service line expansion? Well, we currently don't offer behavioral health services, but they do over in that county that has everything. So let's explore if we can connect with them to use telehealth to connect with their behavioral health providers to create access to services locally. Well, thinking about incorporating community coordination and getting patients into the hospital and clinic, we let the community know we're opened. Parents still aren't bringing their children in for vaccinations or into the hospital. Why? What are we hearing from the community on why they're not accessing our clinic or hospital services? Well, Tina heard from Frank's sister last week that Ann got the virus because she had to go to the local store. So I'm not going into the clinic, and there was only 6 people in the hospital and the clinic. I say that in jest and kind of flippantly right now, but honestly, I had someone come up to me in my local small town Walmart on Friday evening and say just something very similar to me. I need to be careful because a worker tested positively. You should not be here. Well, the truth is the community is concerned and scared and may not be aware of the cleaning protocols, the steps of each of your organizations are taking to keep them safe and your employees safe. How are we communicating with EMS to ensure patients feel comfortable with coming to the hospital? We don't know. I don't think that we have talked to them or see what they're hearing. I hope you've identified at least one theme in the conversation that the hospital and clinic had on the previous slide. Again, it seemed simple, some of those talking points, those questions and answers, but themes of all of that are things that we have heard, that we have worked with different hospitals and clinics in our work. So what I want to do on this slide is we will connect the need or areas identified in those answer discussions to services and technical assistance opportunities the Delta program can assist with. A main idea discussed in that last slide was increasing the use of telehealth, specifically telebehavioral health. Now, a quick reminder, this is just one possibility of how the Delta program can help. And we also recognize that many of you are already working in some of these areas with your team, but all organizations have an opportunity to engage more grant services. You heard us this past week, and many of you beyond that, the importance of engaging your community members and key partners. There are two services mentioned here: conducting community priority needs planning, and two, conduct community town halls with key partners and employees. We'll come back to the employees in a bit. We have transitioned these processes to virtual forums and different formats. The community care coordination team, along with the community champion, will facilitate these virtual meetings. Building off the information gathered in that conversation that we had on the previous slide, we'll utilize the potential partners worksheet with the circles of engagements and the understanding your why tools to identify key behavioral health providers from that county over yonder that has everything, daycare contacts, key community organizations that represent the people in your community that need access to behavioral health services. And carrying forward the needs for your behavioral health services, and through this work, we can target discussion around each partner's needs and what services they have, and together set strategic priority plan on how to move forward to meet all partners and communities' needs. The second opportunity is to gather concerns, barriers, and access to services from your community members' perspectives. Those patients you need and who need to access the hospital and clinic. We can support this work through an online community survey process or using the concept of graffiti walls in public available spaces for you to ask questions to the community members about their barriers to accessing behavioral health or any needs and what they are most concerned about in coming into the hospital or clinic. The person writes the answers in the survey or on these graffiti walls. You can then use this information to create communication messages to answer those questions or concerns, kind of like a marketing outreach plan. By the way, the grant can help walk your team through creation of key messages too, or assist with financial support for creation of website, social media platforms, or flyers. Remember the discussion of need to wanting to know if it's feasible to expand telehealth to include behavioral health? The grant can support and conduct a feasibility analysis of that service line. Well, it was determined that it is feasible to open telebehavioral health programs, so let the grant also help support development of the emergency department redirect program for those that access an ED for behavioral health non-urgent reasons, or to identify processes to intervene prior to needing that emergent care. Employees have questions and concerns too. The hospital clinic knows that quality child care isn't a problem, but what else? What was said in that employee satisfaction assessment that you just did? Or is a quick survey or virtual form needed to gather more information, more current information? Questions will be targeted around what is thought to be a concern or an opportunity, and utilizing the information gathered, it will aid in creating key messages by hospital and clinic leadership to provide an open and transparent communication regarding safety practices and cleaning, the direction of the reopening of hospital services and clinic operations. Remember, the grant can assist with financial support of those key messages in different modes, whether it be the website or social media platforms to help communicate that outreach. The hospital in this example needs telehealth equipment and training on how to use it, and best practice workflows for behavioral health triage and counseling. This grant will help with it. Many of the organizations have utilized telehealth funding for this area or in the planning phase for it. The grant also has monies to support financial enhancement software purchases and training of how to implement and use the software. So the center is currently performing EMS assessments with all local EMS agencies. With this information and inviting them to participate in the community priority needs planning, a plan will be developed with key messaging about hospital safety and to address EMS needs and support with behavioral health. And this is just one simplistic or one example of many that this hospital and clinic could take. The grant offers a customized approach to meet your organization where you're at. In a bit, Karen will share how the Zoom meetings will assist with helping each of your organizations and connecting these priorities. But thought it might be helpful to hear some real voices and examples from the field. We have two key partners with us today, Huron and BKD, and they are both busy working with rural hospitals and clinics. We also have 3 examples from different hospitals and communities as well. But first, let's hear from Huron. Jessica Duke, the healthcare tech manager from Huron. I believe you're on the line with us today.
Yes, Alyssa, this is Jessica. Thank you for having me.
Welcome, thank you. What are you seeing in the hospital and communities that you assist that are helping them to kind of reposition, reopen, and move forward?
I think you gave a great example. Behavioral health is the #1 request, whether it's on the inpatient ED side or outpatient, is in high demand. And that was my first thought when you were talking about this. After that, I think there's a huge focus on wellness, right? We're all shifting away from the sick care, and how can we drive wellness as a perspective for population health programs? Everybody's talking big things about chronic care management and how we're going to better serve those populations. How can we be more strategic in delivering care to those diabetics, COPDers, CHFers? And then if you take a step back from that, thinking about transitional care programs, how can we intervene before this patient's discharged to make sure that we're giving them a better transition back into their home life, to make sure that we're following up with them and preventing that readmission phase. And then we think about it even more so with delivering like dietary services. You know, that's a service line that I think is kind of forgotten sometimes, but is an integral part between that population health and chronic care management. And how can we grow that out utilizing telehealth? And then we can almost spread the wealth, if you want to say, between the different communities with maybe one dietitian or one nutrition. If we think about also the school-based telehealth, this is a conversation that I'm having more and more with a lot of rural health communities. As we transition back to possibly schools coming back into session, if you think about the modeling that's in place pre-COVID, you have one school nurse for hundreds of students, you know, sometimes 850 to over 1,000 students. How is she going to support that triaging of all these students back? You know, how can telehealth bridge the gap? And then how can that rural hospital help support her or him into this care? So that's a really common conversation that we're having with a lot of these hospital systems. And that focuses back on the wellness, but then also, do we have like a triaging sick care modeling that we can support with the hospital systems, with the RHCs through telehealth afterwards? That's a very big conversation that we're having. So it almost becomes like this fix for a crisis, this immediate need through telehealth, but then we start to shift it into an opportunity for growth. How do we build out our market shares, our capabilities into communities that aren't able to have a community health center, or are not able to have FQHC in place, that we're able to bridge that gap via telehealth? You know, it's a great opportunity we all have right here. So, you know, it came about in kind of a negative way, but can we flip it to a positive with all the available funding sources that we have right now?
Jessica, thank you. No, those are great examples. I hadn't thought about the nutrition connection there and sharing that information. That's great. We know many of our hospitals and clinics are doing a lot around nutrition and outreaching with local food banks and things like that as well too. So that's a great, I hadn't thought about that. That's great.
Yeah.
There are, we will have time for questions and answers from our panel here today too. And so I thought I'd give out just a little time for our panelists to talk, and then we can open it up for questions and other discussion area as well too. I believe Eric Rogers from BKD is on.
Hey, Alyssa.
Hi,
Appreciate you
Eric.
having us on today. Thanks. And for Jessica's comments too, on health, I know a lot of our organizations that we're working with, the BKD, have been aggressively trying to implement that. So appreciate all the work Huron's doing. You know, whenever I was back in managing primary care clinics and offices about 10 years ago, we were just talking about telehealth. And, you know, probably I would say one of the number one strategies that I've seen from our organizations that have been standing this up is the operationing of it. And so it's good to have it all set up and in place and have the software and the programs and the staff. But the number one thing is we've got to proactively call our patients. We cannot wait for them to call us to schedule the appointment and say, you know, I'm diabetic and I haven't been in to get my insulin checked. And so repurposing your existing staff. You got a lot of people that are probably sitting around that aren't as busy as they've used to been. Those people have to be making phone calls. Run reports out of your EHR system, sort it by patients with chronic conditions that you may have been doing CCM, billable services, reimbursable services for, and be actively calling these people at minimum once a month and documenting those visits so you can get paid for them, but also keep up the care of those patients. So, you know, for BKD, as we've worked with the Delta for the last few years, the area that we focused on for our hospitals with them is really around the financial side. So revenue cycle, best practices and opportunities, both on the hospital end, which can be pretty complex, but also on the clinic side. And so as we think about how can we continue to partner and support all the hospitals that are part of this program, we naturally gravitate toward the financial areas. In the weeks to come, and I think Alyssa will talk about this a little bit more, we're going to do some deep dives and talk about some of the following topics, such as a single audit. If we've received funding from different sources, how do we prepare for a single audit and make sure that we're ready? Do we have the right documentation in place? Have we assigned a compliance officer or other support staff to be gathering information in preparation for that? Travis Skinner, who's on the call today, he helped hundreds of hospitals across the United States several years back whenever the EHR money was available. And I know most of your organizations, you went through that process. There was good money that was out there and available, but it was also very important to document how those funds came in and prepare for that. So it's going to be very similar to that if you want to think back to a few years ago. Some of the other really big questions, Alyssa, that we've been fielding as a firm relate to federal guidance. How do we define lost revenue? How do we properly define expenses for our organization so that we can hold on to as much of those funds as possible? So in the weeks ahead, we're going to share with you some of the most current guidance that comes out. And it's sometimes daily, sometimes weekly. Our lobbyist that works in Washington, D.C. will continue to be working with us, and we'll share that information with you on what can and cannot be considered revenue and expenses. We'll look at some opportunities for your organization to track these funding sources and make sure that they're following the appropriate waterfall and you're dipping into the right buckets of money at the right time. This SBA PPP tracking will be very important, and the methodology that you elect to use with your organization. Business interruption. For some of the hospitals, there will be business interruption opportunities as well, so we'll look at that. Cost report. Obviously, as an accounting firm, we've got a lot of people that look into how is this going to impact my cost report, filing interims, am I preparing that? And so giving you some suggestions and recommendations for how to work with your current auditors to be ready for that. The last thing that I'll touch on today is the revenue cycle. A lot of organizations have shifted their staff to be remote, working from home, and that can be a good thing, but it can also be a challenging thing whenever it comes to maintaining key performance indicators. So keep a very close eye on your accounts receivable, keep a close eye on your denials and how those are trending. It can be a lot more difficult to be productive at home. I'm in the middle of a Honda minivan right now, out in the middle of using vacation right now with 3 little kids, and I am not productive at all. And so I really feel for those people that are trying to work from home and drop claims and work denials from their bedroom with kids in the other room. It's tough. And so as leaders at the organization, how do we support our staff that are working from home, and how do we begin to move them back on site at the right pace and at the right time for the organization and for our best assets, our employees? So Alyssa, I'll turn it back over to you, but we look forward to getting into more of these details over the weeks to come.
Great, thank you, Eric. And Karin will be taking some time to walk through some of these, where we'll deeper dive with each hospital, clinic, and their team regarding creating a plan around what they're currently doing and in additional areas that we can help with. And I know you guys have some great webinars coming up on all these key topics as well too, so that's great. I think what I'd like to do now is kind of hear from some of our hospitals and our champions in this next couple of minutes, and then we'll open up the discussion for everyone. You know, Christian is a community champion with Savoie Medical Center, and I'd like to ask you, Christian, how has your hospital worked with the community in this time and to reposition? Christian, are you on the line?
Yes, I am. Good afternoon, everyone. Well, for our hospital, one of the first things that we established, well, one of the things that we worked on establishing was a daycare for our employees, those of employees. We were able to get this done with the help of Volunteers of America. And we had an average of 6 kids to 3 volunteers on a daily basis. We did close it on May 15th whenever phase 1 was beginning to take place. And the cafeteria, our hospital cafeteria, provided those meals for the kids as well as the staff. I am currently working on developing questions for a community health survey, as well as a telehealth survey, because we did use telehealth with COVID. It was very functional, but we kind of need the community's point of view on how did they like it. Did they prefer that to in person? The community health survey is going to kind of cover how did we as a hospital, we function? Did they think we were vigilant? Did they think we were too relaxed? So kind of getting that part, information is going to help us in case this second wave, you know, does come into effect. You know that us being in Louisiana, it's very likely that we're going to probably experience a couple of difficulties as well. So for the community health survey, I'm looking to gear that more towards the joint partners, because they have more of that contact with the community, because the community still, of course, they still have their fears in regards to COVID. What helped with that transitioning back was we did put an article in our local papers, just letting them know that we were safe, the measures that we were taking to ensure their safety here. A lot of people were very hesitant with outpatients, so we had to kind of give them that security that, okay, we're good, we're okay, we're disinfecting, we're sanitizing, we're clean, we're using PPEs, it's safe for you guys to come back in. So that's kind of what our part has been here at Savoie. And I'm complete.
Great, thank you, Christian. Trisha from Natchitoches Regional Medical Center, I believe you're on. If you are, you may need to unmute your line.
Hi, I'm here. Hello, everyone.
Hi, Trisha, thank you.
I think our hospital has been proactive in educating our community about the COVID-19 outbreak and preventative measures and ways to prevent the spread and take care of themselves. And with the initial panic of the people being testing positive, there were like a lot of rush to the emergency room, to the clinics, of people demanding to be tested, and organizations sending their employees to the ER, to the walk-in clinic to be tested. And so I guess the hospital was able to secure some state funding to open a COVID public testing site out of the hospital campus, where they have community members that have symptoms of a fever greater than 104 or have symptoms of COVID come and then be tested. So it was a drive-through testing with 3 tents. We have a screening tent where they stay in their car, and then the provider, they talk with the provider, and she screens them, and if they qualify, then they move to the next tent where they have the scribe and get their details and their information. So they'll be able to call them with their results, and then they go to the next site, which is the testing site, and they get swabbed. And that was kind of helpful for the community because it kind of gave reassurance to people that they can be tested. So being able to know that you're tested and you're negative made a lot of people kind of reassured them of their health and of where they stand in the community. And our QI director, Sarah, and our CEO, they've been doing frequent updating the staff, community member on what's going on in the community and the numbers and the CDC's recommendations, the state recommendations. And we've just been making sure everyone's aware of what's going on. And the testing site kind of help open up the emergency room and the clinics for people that have real emergencies and have real medical problems and to come to the emergency room and come to the hospital, because knowing that there's a testing site outside, so they're not, that fear of coming to the hospital and getting COVID from COVID patients was reduced. And I think presently the National Guard is doing the testing at the testing sites. And so we've been able to focus on taking care of the hospital because the testing site required us taking staffs from the hospital and from the working clinic out of their normal routine and short staffing other departments to operate the testing site. So with the National Guard doing that now, everybody's able to return to their department and resume work as usual. And I'm complete.
Thank you,
Hey,
Tricia.
Alyssa,
Yeah.
I see that Mary Bleakler raised her hand.
Great, Mary. Did you have a question or would you like to share? You will need to unmute yourself. We'll pause right there on that, and maybe she'll be back with us in just a moment. I know Ashley Anthony from Delta Memorial Hospital is on too to provide another voice from the field in how they're working with their community to reposition. Ashley? You may need to unmute your line.
If you go to the participants list, you'll be able to unmute yourself.
Okay.
If you're muted right now, or otherwise you should be able to go to the black bar on the bottom and select the microphone icon, and that'll unmute you.
Great, thank you for that reminder, Jesse. I appreciate that.
Yeah, no.
Well, I don't. I see Ashley's. Yep, here we can hear you,
Ashley.
Ashley. Thank you. Mm-hmm.
No, it's actually Mary Bleckler.
Oh, I'm sorry, Mary.
No, that's okay. I was having a little trouble here. I just wanted to say in regards to calling your patients, I guess I have an opportunity, since I have a dual role as a sonographer and a champion. One of the things that we do in the imaging department is we do call our patients and talk to them about their scheduled exams coming up, which allows us to find out what their concerns are and to also let them know that we are doing everything we can to keep them safe when they come to the hospital. So that seems to really put the patient at ease.
That actual physical phone call from you guys?
Yes, it seems to have made a difference. We've always done that, but it just seems like with the COVID, it's really made a big difference.
And Mary, and I guess I'll ask Patricia this too, what is that number one question or concern that you're hearing when you talk to your patients, when you call them, Mary?
They just want to know if we have any active cases in the hospital, you know, and that's something that I won't address with them because I don't think it's my place, and I will tell them that within our department, we know that it's safe for them to come in and that we were taking all the measures. They'll have their temperature, the mask, the whole, you know, the whole spill that we give them at the front door, and it's, you know, it's safe for them to come in. I've had very few that I have talked to that have refused to come. In the beginning, yeah, a lot of people were canceling, but lately, I'd say within the last 3 to 4 weeks, everybody's been very receptive and has been showing up for their appointments.
Great, thank you.
Yes, thank you. I'm complete.
Thank you. And Ashley, I believe I saw on the participant list you're able to unmute yourself. Are you there now?
Yes, Alyssa, can you hear me now?
I sure can, Ashley. Thank you for joining us today.
Okay. Well, thank you for having me. You know, we started this journey back in February, and it's been a long several months, as everyone feels that. So over the last month or so, we've really been working toward how to get our patients back in and how we can support the community. So we've done some community outreach events, some testing in the community for COVID-19, as well as the antibody test. And then we've also worked on some community outreach as far as education to the community. And right now in Arkansas, we're starting to see our numbers rise. So we're really just now getting to COVID-19. So for the last couple of months, we've just kind of been sitting here, but now we're really starting to see our numbers increase, especially in our area. So we're starting to reach out to some of the industries and businesses here to see how we can better assist them, provide education, testing, whatever it might be, because we're finding that those individuals in the community do not have the knowledge that we have, obviously. So being able to provide some education and a resource to those individuals has been beneficial to them. And then also just working to get our patients back in. We're about 4 months into our patients that haven't been here for their chronic conditions and management of those conditions. So calling our patients, we've ramped up our program to call those patients and try to get them back in so they can get their wellness exams and, you know, just wellness preventative stuff done so that we can get them back on track. As far as staff goes, you know, this is really stressful time for everyone. A lot of staff have, we've been fortunate that our staff have not been furloughed, but we do have staff who have spouses that have been laid off or what it, you know, whatever may have happened financially. So that's a burden for our staff. Daycare is an issue, but not as significant, or it has not been here as significant of a problem as just the financial burden and stress that all of this has had on our staff. So really want to work toward addressing some of that for them and helping them with maybe some financial counseling for personal well-being down the road. So that will help them and overall, you know, well-being and help their anxiety and fears moving forward related to that. And then for the hospital, we really have just been working on, you know, looking at the future and what we see may happen. Of course, it's all unknown, but trying to take what we've learned from the last several months and apply it for the rest of 2020 and what we need to be prepared for the next half of this year. So making sure that we have testing.
Well, it looks like we may have lost Ashley.
And really just, and again, continued education for staff and then the community as well. And then on the financial side, just making sure that with all of the different funding that's come down with this, making sure that we are on target with those things, and all the proper bookkeeping is done so that we will be in a good position moving forward with our audits and stuff as they come along. So that's pretty much where we are and what we've been doing.
Great, thank you, Ashley.
And Alyssa, I see that Deborah from Delta Memorial also wrote in the chat box. I'll just read that quickly.
Great, thank you.
Along with their numbers that have spiked in Arkansas, they are also working with their food pantry because as numbers are going up, people are becoming less physically active. They are providing food packages and also get up and move, stay at home workout routines. They are working with churches and providing information.
That's great. Thank you, Deborah, for sharing. And so, Bethany also mentioned or reminded me that piggybacking off of an example or what Ashley was sharing in regards to financial training for staff, we would like, that is an opportunity that the Delta Grant can help support financial training. We can also bring in Eric Scorsoni, who we met and talked with us last week as well, to help consider more interconnectedness with the community development support that your communities may be working in as well. What other questions or comments would people like to share? We have a few minutes that we would like to open up for the group to either be able to share that they're doing, or if there are questions for some of the examples that the hospitals have provided and Jessica and Eric have provided as well. And feel free to use the chat box or speak up verbally out loud as well. Also open it to our Delta team here at the center. Are there any comments or examples that you would like to share or anything too?
Alyssa, this is Bethany.
Hi, Bethany. Thank you.
I just want to give a reminder to everyone. Besides, yes, financial is always at the top of our minds. Of course, all the operational questions that that Eric just chatted about. Jessica did a great job thinking about some telehealth. We really do want to help you take this opportunity with these with some great consultants working to collaboratively and think about this just a little deeper, and not just think just financial, but think even more operational, since we do have access to some great consultants here. And don't forget about quality, because quality is driving everything. So if you bring up a topic, we're going to ask about quality. How's it working in, how we can support you on that. And that rolls out to yes, transitions of care management that help you think broadly with community care coordination. So I hope that just summarizes just a bit more, and just more of a good reminder. So when you're making your wish list, you can have this at the top of your mind. Thank you.
Thanks, Bethany. Why don't I hand it over to Karin, who will walk us through kind of our next steps for the program and those Zoom calls that we'll be having in the next couple of weeks. Karin, I hand it over to you.
Thank you. I just want to remind everybody, if you have not already sent your Zoom meeting 2 options to Robbie, please do that. If you cannot find her email in your emails, then please, any member of the team would be happy to pass this information along. Expectant attendees, we've got executive leadership, key directors and managers, and community champion. I also want to add that if these dates do not work with your team schedules, please let us know as soon as possible, and we can work with you to find some additional time slots that do work. And what can we expect on these Zoom calls? The reason that we are trying to meet with you in smaller groups is because we want to help you strategically coordinate your priorities with your hospital or clinic staff and our consultants. You may be wondering, how do I prepare for something like this? It sounds a little bit like I'm not sure what's going to happen. We would like you to work with your team to start to consider and discuss what kind of a holistic approach you guys can develop that stabilizes and positions your organization for the future, whether that is a second wave of COVID or just being stronger and more resilient in your communities. Based on your requests for technical assistance services, we can help you plan those services in a comprehensive manner to be sustainable. We have included in the chat box a blank template that could be useful in your discussions with your team and employees. It is called the Technical Assistance Summary Template or Planning Template, and that might be useful. We'll also be using that on our side to help take notes so we can listen better and help you plan for the future. Some of the questions that we hope you guys can start talking about are listed on the slide. What kind of TA do you want from us? What is that wish list that if you were dreaming big, that we can help you accomplish? So these are some of those things that we would like you to discuss with your team, and know that we want to talk with you about that more in our Zoom calls too.
And Karen, if I could just interrupt, this is Alyssa. On those Zoom calls, like Karen mentioned, they're much smaller group meetings, and you'll be paired with another hospital and team too for that discussion. So it'll be a networking opportunity to share and to walk through as well. Sorry to interrupt, Karen.
Well, thanks. I think so. This is Kate again, and Eric Rogers touched base a little bit on some of these topics that will be covered coming up. So as part of our next steps to really support all of you moving forward, we've been working with BKD to pull together a 5-part financial recovery webinar series. So these will all take place on Fridays from 11 to noon, starting July 17th. And don't worry if you're gonna miss one, they'll all be recorded and sent back out. There's hyperlinks here right here to learn more about what those topics are. I know Eric, like I said before, walked through it a little bit. They are posted on our website too, and then you'll be getting an Outlook invitation from Cinnabon to get that planted right onto your calendar so that you don't miss them. So like I said, those will be coming up. The format that we're going to use for this, as we're working through BKD, their subject matter experts or their consultants will come on and share 30 to 40 minutes of content, really giving you the content that you need. But then we're all going to open it up for open discussion too, so that we can hear from you some of your pain points and some of the questions that you have for those consultants. And it will also help, with peer sharing, you're going to be hearing from your other hospitals on the questions that they have. But it also helps us too to really know what those pain points are and how we can assist you moving forward, specifically in this area of the program. So like I said, all the sessions are going to be recorded if you miss anything, and they'll be sent out to the listserv. So with that, I just want to thank everybody so much for your time today. We're really looking forward to those Zoom meetings to learn specifically about how the Delta program can support you with technical assistance moving forward, and so interested in those conversations that we're going to be having. And don't be nervous about those meetings. Like Karen said, if you're feeling like you're not quite sure, take a look at that template. Those questions are really there to trigger those thoughts in your head of what's needed. And this program provides a lot of flexibility. So we're looking forward to hearing from you and how we can support you. With that, I just wanted to see if Alyssa or Bethany had any final comments before we close today's session.
Hey, I do. I just really want to emphasize to the hospital teams out there that from the Zoom meetings, just like Alyssa was saying, to create that plan, what is it that you need, and we want to help you roll it out. So just to emphasize, we're not dragging this out. We really want to start your projects immediately, support you as soon as possible, and roll it on.
Yeah, thanks Bethany for that reminder. That is a great closing. We're you know, we're really hoping this complements and what you're already working in areas as well too. So we're looking to these conversations with you in the next over the next couple of weeks. And if there are any questions or concerns ahead of time, please do not hesitate to outreach to any one of our team members, and we'd be happy to talk with you. Again, thank you for taking the time today for joining us and the conversations. We really appreciate it. With that, I'd like to, if there's no other questions from our participants, I'd like to close our meeting today. Thank you.
Thank you.
Thank you.